Hi, I'm Amy Iannitelli, Executive Director at Circle of Friends Services. Circle of Friends is a not-for-profit community mental health agency that provides outpatient counseling to children and families in child welfare. In recent years, we've really become specialists in providing post-adoption services. And what I'd like to talk to you about today is what that process looks like and what to expect from counseling and therapy in the adoption process. So the first issue I'd like to talk about is what kinds of issues will we be helping you and your family to deal with. In adoption, many adoption families experience similar issues. These issues does not mean that your adoption is failing, does not mean that you've done anything wrong. This is just what's to be expected from the adoption experience. Many of these issues include grief and loss. Children who have been removed from their biological parents and placed into foster care or other types of placement and are now being adopted have experienced numerous losses, and grief and loss is something that they need help to process and to be able to express. Another issue is trust and attachment. They are now forming a new relationship with you and you with them. So working on these relationship issues and learning to bond and learning to form this relationship is something that we can help your family with. The next issue is identity formation. A child, really no matter what their age, particularly if they are older though, is going to be forming a new identity. They're going to take part of their old identity and integrating that into your family and helping to be inclusive of everything that they are. Families need help with this. It is hard to know how to respond to their past memories, their biological parents, and to be accepting and understanding of all that they are and all that they've experienced. And they're going to be learning about you and experiencing, what your family is like, creating new traditions and new routines and those types of issues that we can really help with. Again, these are all very normal and we can help with this process. So how do we help? I'd like to talk a little bit about what to expect maybe from the first session and ongoing sessions. I think a lot of families, when they think about counseling, they think about maybe the child going in and seeing the therapist, talking with them for an hour and then coming back out. Adoption therapy is quite different. Adoption therapy is about engaging the entire family. So family therapy is the primary service. What this looks like, we provide in-home counseling and we also provide in-school counseling. However, in school is probably not going to be very effective for any adoption-related issues because it's missing one really important piece, and that is you as parents. So adoption-related needs to happen in the home with the entire family, or at least the parents and the kids together. Some of what we can do during this time is we can provide guidance on parenting. We can provide support if expectations are not being met on either side. And most importantly, we can provide a lot of support and education on how to respond to your kids' trauma. They have experienced lots of trauma, and that can look very different for lots of kids. It can mean that kids are acting up, that they're not able to self-regulate, that they're having difficulty with attachment. And the response of the caregiver is really what will help heal this child and heal the family. So we're going to help guide you and give you the support on this really difficult issue. And we will be there for you every week. And this brings me to my next point, is that consistency is super, super important. Now, every family is different. Some families will not need lots of services and lots of counseling. They might need only services for a short time, maybe only several months, and things are going well. Other families are struggling a little bit more and will need services much longer, maybe even over a year. Some families might also experience difficulties or need services at different times in the adoption process. Maybe they've adopted as the child as an infant, and now later they're experiencing some difficulty at a certain milestone or at pre-adolescence. But either way, this is to be expected, and whatever you experience for your family is normal. So try not to judge yourself compared to other families. This is just what your family needs. And as therapists, we want to partner with you, and we want to help you to make these decisions. I'm a licensed mental health counselor, and I've worked with lots of families in the adoption-related process. Some who have just adopted the children, some who have had the adoption for several years. And I will say that, the one thing that they do have in common is that grief and loss and trauma does impact families. And the most important thing that the families can do is that the parents are the agents of change. The parents' relationship with their kids is what is going to heal them. And as a therapist, I would like to partner with you to help you to heal your kids and to make this adoption successful and beneficial for everybody. There's lots of ways that therapists do this. Therapists have different approaches. At Circle of Friends, we really try to focus on building activities, building experiences that will, such as planning a meal together, or having a play date, or going somewhere where you are doing this together as a family. This will encourage bonding and attachment, trust and acceptance. And then we're going to help you to process these experiences, talk about what your needs are with one another. But most importantly, it's an experience. So I'd like to encourage you to partner with your therapist, talk about what your needs are, and just know that all of this is very, very normal. And we look forward to working with you and helping you. So this is part of our adoption series. If you'd like to hear more about adoption-related issues and how we can help, please check out our Circle of Friends YouTube channel. Thanks.